Well, dark circles under the eyes are one of the most common cosmetic concerns, and today we're going to talk about a natural treatment option that's been getting a ton of popularity, PRP injections.
Yes, today we're joined by Jessica Kubacki, who specializes in under-eye rejuvenation, to really talk about dark circles and whether PRP might really help. But I do want to start just kind of talk about those of us who, I've struggled with, I was born with like dark circles under my eyes, so I know for me it's hereditary, but
absolutely,
there's lots of different causes for dark circles. Can you talk about that a little bit?
Yeah, so I was going to start with that. Typically it is hereditary, but I think that a lot of GLPs are causing people to see a little bit more darkness with quick weight loss. So if you start seeing herniation in the cheeks where those fat pads sit and you're losing weight too quickly, you can start seeing a little bit of darkness when the light hits and you have hollowing under the eyes.
That makes sense, right? So I understand why more and more people would be experiencing that if they're on the GLP-1s. What about just PRP in general? For people that have never heard of it, I've used it, I can swear by it, it is wonderful, but what exactly is it?
Yes, so PRP is platelet-rich plasma, so there's no additives. We just draw your blood. There's a tube that has a gel separator in it, so once it's spun, you see that red blood cell portion in the bottom of the tube, and then I like to call it liquid gold is at the top, and that's what we draw out and we inject it under the eyes. You can also use it in the hairline for hair restoration as well as microneedling.
Interesting.
So, I like
lips?
to use
Can
it.
I put it in the lips? I'm looking for a natural plump.
Oh, Lordy.
I want hers.
I have injected it into the lips, but really that plump is only gonna last the first 24 to 48 hours. So it's nice for promoting collagen and elastin, but you're not gonna necessarily be happy long term.
Thank you for being honest about that.
Yes.
That's great.
Well, and let me ask you, so is this something that you have to do? Because I know with like Botox, mamas do, you got to get that every like 3 months or so.
Yes.
Is this something you have to keep doing consistently,
Good
or can you
question.
get it once or twice and, that sustains you for a couple of years?
Absolutely. So I always sell it in a series of 3. So you come every 4 to 6 weeks, and then after that, if you want to, you can do maintenance treatments. But unfortunately, it is one of those things you have to do yearly. So it's not one and done. Once you get the series, you do have to keep coming back.
And it's using your own collagen to build collagen. Am I getting that right?
Yeah, so
Okay.
once we draw, yes, essentially. So once it's separated from those red blood cells, the platelets have growth factors, natural growth factors. So ideally, you want to make sure that the patient is healthy, eating healthy, working out, always making sure you avoid alcohol 48 hours before, caffeine 24 hours before, and then increasing your protein intake before you come in.
And is this for everybody? Like, who might not be the best fit? Or, I feel like you're very honest about these things.
Yeah.
Who would come in to you and you're just like, this isn't going to be worth your money or time?
Yeah, that's one of my favorite things about working with Dr. Hassan, because we can kind of bounce off each other. So if somebody has a herniated fat pad, meaning you've probably seen some patients who have more of like a protruding area under the eyes rather than hollowing, that is somebody who's a good candidate for a bluff. So I don't necessarily want to waste someone's money and do the treatment before they have surgery, but it's a great add-on after getting a bluff. So it'll help heal that area.
And a bluff is like a
Cutting out, so Dr. Hassan will go in underneath the eye and he'll cut out any fat there. So once you pull that out, you don't have that herniation that's protruding, rather it's smoothness. And then the PRP is a great add-on to stimulate and heal collagen, elastin.
and downtime.
Yeah.
Like
Yes. So downtime, the worst swelling is 24 to 48 hours after the treatment. Honestly, a lot of patients prefer to have that swelling.
And this is after three
sessions.
injections. So what is the price of like a 3, let's see if this is affordable for us here.
Yeah.
3 sessions would run you how much?
$2,050 for 3, and then one-off sessions are $750. So I always tell patients to buy the package. We do those, and then if you want to do one-off around the holidays or before a birthday, an event, it's really nice to add on.
Oh my gosh, this is great.
But that Santa, I would like you to know, Santa, aka my husband who's watching, I would like this for Christmas.
That's all I want for Christmas is
That's
Botox
right.
and PRP.
Right, and I love that PRP is natural. Love that.
Yeah, because you're not
No
not
additives.
putting a filler. Because I've read so many scary articles about people who put fillers under their eyes, and it can migrate. It can cause problems with your eyesight. This is natural.
Yes, so natural, no additives, and I'm really glad you guys brought that up, because with filler, if it's not placed deep enough under the muscle or against the bone, you can actually get something called a Tyndall effect. So as the light is hitting me right now, if I didn't have makeup on, you could see a blue hue.
Oh, no.
And so dissolving filler would obviously not be fun. We don't want to ruin anybody's area under the eyes.
Oh, you know your stuff, Jessica. Thank you so much.
Of course.
Appreciate
Thank you guys for having me.
We'll be right back.